Hello, my name is Dr. Eric St. Pierre. I'm an emergency physician and emergency department director at Northern Maine Medical Center in Fort Kent, Maine. The purpose of this presentation is to help inform our employees and our community of what the steps our organization has taken to prepare for a possible coronavirus COVID-19 outbreak. For those of you who may not know where we are located at the farthest northern port of Maine. We are a 49-bed acute care hospital that has an emergency department, an intensive care unit, an operating room, medical floor, an ICU, obstetrics, and multiple clinics. Before we talk about what we've done to prepare, I think it's important that we start by giving you some basic information about what is the COVID-19 coronavirus. So coronaviruses such as SARS and COVID-19 are different than common cold viruses or influenza viruses. The disease itself attacks cells deep in the lungs, and they can lead to very serious lung infections and pneumonias in certain people. So why is it so dangerous? Well, you may have heard about the R0 factor. And R0 is basically the factor that describes how contagious an illness is. Well, coronavirus has a much higher R0 factor than most common colds or influenza, and given the fact that it is much more serious, then it is a much more dangerous virus. The other thing about COVID-19 coronavirus is it's not responsive to most antiviral medications such as Tamiflu. And there is also no current vaccine for this, making it much more dangerous. In order to understand how to control the spread of this virus, it's important to know how it's transmitted. First of all, this virus is spread via droplets. It is not airborne. That means that generally you catch the virus by touching surfaces that have been contaminated by the virus, and then touching your face, your nose, or your eyes, and then the virus is transmitted within you. So it's unlikely for you to get it in an airborne fashion unless someone actually coughed or if they sneeze directly into your face. The one thing about this virus that's important to know is that it can be neutralized using simple hand washing with soap and water or an alcohol-based sanitizer that contains at least 60% alcohol. It's important to know who can transmit this virus. Not only people who are symptomatic that you can see that are coughing and sneezing and have obvious signs of illness, but sometimes young children can get this and have minimal symptoms. And as all of you know, children have a tendency to cough and sneeze and touch things without using precautions. They also produce a large amount of mucus. So children, even though they may be mildly symptomatic, can spread this virus to adults. It's also believed that the virus can be transmitted early in the disease, even sometimes when patients have very minimal symptoms. So that makes it even more dangerous. How can you prevent the spread of the virus? So the most effective way to prevent the spread of COVID-19 coronavirus is really washing your hands. This has to be done properly, has to be done for at least 20 seconds when you do it. An alternative that's been shown to also be effective is the use of hand sanitizer, and a hand sanitizer that has at least 60% alcohol content. Now, it's very important that you educate yourself on how to properly wash your hands and also how to properly use hand sanitizer. And for this, there are many videos available to educate you on how to do this. Another effective technique is called social distancing. And this should be done both outside and inside of your workplace or your hospital. A distance of 6 feet is recommended so that you don't come in contact with the possibility of somebody who is coughing or sneezing. As you can see by the following diagram, the less contact that people have with others, the less chance they will have of spreading the disease. How else can you prevent from spreading the virus? Well, wearing masks and protective eye shields or goggles can help prevent droplet transmissions, especially in rooms of patients who are receiving nebulizer treatments or where there's a possibility that the virus may be aerosolized into the air. This is also very important why patients who have COVID-19 really need to have a surgical mask put on so that they don't cough and sneeze into your face. So that should be one of the first steps you take to try to prevent this when you see a patient that could possibly have this disease. Another step that you can take is quarantining yourself and your family, and staying home when you don't need to. Only limit your travel outside of your home to either go to work if you're an essential service, or go to the grocery store or the pharmacy when you need to. Social distancing also means not getting together with friends and limiting your interactions with immediate family. Now, the other thing that's important is to practice hand washing even inside your own home, which a lot of people don't realize how this can help prevent the disease amongst your family members. What are we expecting as a community with this COVID-19 coronavirus? Well, we know that 80% of the people will have mild illness, probably similar to influenza. However, about 20% of the patients are going to have serious disease and may actually require hospitalization. Out of those 20%, another 5% might need hospitalization in an intensive care unit and may even need mechanical ventilation. And we're estimating that the mortality rate from this virus will probably be somewhere around 1%, which is quite high compared to other viruses such as influenza. It should be noted that there is a certain trend towards high-risk populations getting much sicker than the normal population. Who are the high-risk populations? Elderly patients. They are certainly at higher risk, and there's not a definitive age, but they've certainly noticed that patients over the age of 60 are at much higher risk of serious disease and also possible fatal illness with this. The other people that are susceptible to getting very serious disease would be people that have already other medical problems such as heart disease, diabetes, lung problems, immune deficiency, or cancer. So if you do have any of these diseases, or if you are elderly or older, you definitely have to take some extra precautions with regards to this virus. The good news is that young children seem to be spared, especially young children under 10, and they don't seem to get the disease as serious as the rest of us. What is our hospital expecting? We need to learn lessons from what's transpired in other countries such as China, Italy, and currently in our own country. This can't be taken lightly. This can easily overwhelm our healthcare system, both on a statewide level and here locally in our county. We could see a large increase in patients presenting to our emergency departments and admitted to our hospital. We could also see a significant amount of patients that are going to be requiring admission to the intensive care unit and could also need mechanical ventilation. But the most important thing that we need to take into consideration is protecting our healthcare workers. We will need them when this pandemic strikes in our local community, and we need them to be healthy. So we need to take all precautions that we can to keep our employees safe. So how is our hospital preparing for this potential pandemic to coronavirus? Well, the first thing we did is we formed a COVID-19 response team. That response team has members of administration and the medical staff working together to prepare and plan for what is to come. The members of our team, from an administrative standpoint, consists of our executive branch of leadership. That includes Peter Sirois, our Chief Executive Officer, Alain Bois, who's our Chief Operating Officer, Cindy Daigle, who's our Chief Financial Officer, Nicole Marquis, who's our Chief Nursing Officer, and Sue DeVoe, who's our Chief Experience Officer. From the director level, we have Jennifer Albert, who's the Director of Quality and Infection Control. We have Travis Gee, who's the Director of our Long-Term Care Facility, Robin Dambois, who's our Director of Human Resources, Carrie Thibault, who's our Director of Medical Practices, and Joanne Fortin, who's our Director of Communications. We also have 5 members of the medical staff that are committed to this COVID response team. The first being Dr. Majid Taj, who is our Medical Director, Dr. James Harris, who is our Associate Medical Director and Hospitalist, Dr. Michael Sullivan, Vice President of the Medical Staff and also a hospitalist, Dr. Kristen Hart, who's the Director of the Obstetrics Program and also a family practitioner, and then myself, Dr. Eric St. Pierre, who's an emergency physician and emergency medical director. So we started planning this basically at the end of February, and we started doing daily meetings in mid-March. These daily meetings basically provide us the opportunity to plan and to discuss different areas that may need attention with regards to COVID-19. What we've done is we've provided the staff and the employees with a newsletter called the COVID-19 Alert. This is done on a daily basis by our Chief Operating Officer and is sent off to the staff for them to review. Our Chief Operating Officer also provides us with a daily update of what's happening both at the local level, the state level, and the national level. What's one of the most important things that we need to do when we prepare and plan for an outbreak such as this? Safety. So from a safety standpoint, we've instituted some of the following actions. The first thing we did is we decided to secure the building and limit the amount of entrance points to enter the building. We've begun restricting access to essential personnel only, and we've limited our visitors and changed our visiting hours in order to reduce the chance of any type of transmission of COVID-19. We've started screening employees and visitors as they enter the building, and we provide an area of secondary screening for any employees that may have upper respiratory symptoms or have traveled out of the area. We've restricted meetings to those that are only essential to the functioning of the institution, and we've also allowed people to video conference in to those meetings so that we can provide appropriate social distancing. We've also allowed certain employees to work from home. We are recommending that employees avoid large groups while working and to practice social distancing. We're recommending that employees eat at their designated break rooms or workstations and limit the cafeteria to those who do not have an area that they can eat in. We've canceled all self-service stations in the cafeteria, and we've provided meals to go. We're now also providing on-site laundry services for people's scrubs. That way we can reduce the risk of bringing contaminated clothing home. I would like to make a special note of the people in our environmental services staff. They've been working exceptionally hard to keep our hospital clean and sanitized, and this is so important when we are dealing with a possible outbreak of coronavirus. How about our policies and procedures? One of the most important things to do in a pandemic such as this is testing. Unfortunately, the state of Maine only has a limited amount of test kits, and because of this, they have limited resources to be able to test patients, and we have to prioritize those who are tested. Currently, we prioritize patients who are admitted to our hospital, our healthcare workers, and our first responders. The Maine CDC provides us with guidance with regards to testing, and this is changing on a daily basis, so we will adopt those as more test kits become available. We've also developed policies on how to manage potential COVID-19 coronavirus patients when they present to our clinics and to our emergency department. We've helped develop policies on how to transport these patients within the hospital if they do have to go from one department to the other. For example, the emergency department to the ICU. We've developed guidelines on how to properly clean patients' rooms and equipment after exposure to potential COVID-19 patients. And we've now also started offering telehealth services that allows our patients access to medical care without having to come to the hospital or the clinic. Our obstetrical department is also working very hard to develop policies to protecting our existing patients against COVID-19, and in the unfortunate event, should a patient who is pregnant develop COVID-19, on how to best care for them while they're here in the hospital. From a buildings and grounds department, we've actually designated certain areas of the emergency department for COVID-19 patients. We've actually set up an alternate respiratory symptoms clinic where patients can be seen with fever or cough instead of going to the emergency department or to the regular clinic. This helps keep our emergency department for our most critical patients. We're now also starting to develop a surge plan. Since COVID-19 could bring a large amount of patients, we may actually have to open up new areas of our hospital or designate other areas such as our operating room to treat and hospitalize COVID patients. From an equipment standpoint, we've purchased our own lab analyzer to be able to do our own testing for COVID-19, and we're hoping that will be available very shortly. We've gotten software upgrades, special filters, and modifications for our current ventilators to allow for the best management of COVID-19 and these patients who oftentimes have acute respiratory distress syndrome. Supplies, one of the most critical things that we're hearing about today. We continuously review our supply of personal protective equipment to include masks, gowns, gloves, and face shields to ensure that we have enough. We've looked into purchasing reusable equipment that we can clean and reuse, since all of this equipment is in short supply both at the state level and nationwide. We also have a special supply of hoods called PAPRs that have mechanical respirators and a mask that looks similar to a space hood that will protect our staff during the most hazardous procedures, such as intubating a patient and placing them on a ventilator. We've actually asked members of the community to help provide us with cloth masks that they have made to put over our existing N95 masks so that we can prolong their use. And we've also started to make our own face shields. Our hospital is also continuously checking to ensure that we have enough cleaning supplies, hand sanitizer, food, and other critical items that we're going to need that may already be in short supply. And we've been able to speak with our pharmacist to make sure that we have appropriate amount of medications, not only for COVID-19 patients, but also for our regular patients, since we are also seeing areas of short supply in this department throughout the country. Our hospital here locally is also working with both state and national organizations. We currently monitor and review the state CDC website along with the federal CDC website to see what new recommendations are coming through. We participate in national and state teleconferences. We receive and review information from both the Maine Hospital Association and the American Hospital Association. And as an emergency room director, I personally take part in a weekly conference by the Maine chapter of the American College of Emergency Physicians, and also a national forum that allows me to share information and resources and allows me to be updated at all times on what's going on with COVID-19. From a training and education standpoint, we've provided our staff with flow diagrams that help them decide on how to manage COVID-19 patients and also how to test. We are also providing our staff with education on how to properly don, which is putting on medical equipment, and doff, which is removing personal protective equipment, without risking contaminating themselves or others. With the help of our staff educator and director of anesthesia and surgical services, we are providing simulation sessions using our high-fidelity mannequin on how to properly intubate a COVID-19 patient who requires mechanical ventilation. This required modification of our existing policy to reduce the amount of possible exposure to the virus that could be produced during this procedure and provide the staff with the maximum amount of safety and protection while we do this procedure. Communication is critical during these difficult times. Our Chief Operating Officer provides us with a daily report called the COVID Alert that is published and sent off to all staff members so that they are aware of what we are doing to plan and prepare for this outbreak. We've also asked all managers and department directors to frequently round on their employees to help support them, answer any questions that they may have, and provide clarification on what's happening at our hospital. Certain staff members wear Ask Me buttons, and that designates them so that employees know that they can ask them questions with regards to COVID-19 and address any concerns that they may have. Our hospital Facebook page is also providing information to both our employees and the community on any updates regarding COVID-19 and what's happening locally. We have produced this video to reinforce what we've done as an organization to prepare for this virus and to encourage you as employees to address any concerns that you may have with any members of our team or your department directors. Human Resources is also working hard to come up with projects and ideas to keep ourselves motivated and entertained through these very difficult times. In summary, We wanted to take this opportunity to help inform our employees and our community on the steps that we've taken to try to provide the best possible care for any patients who present with COVID-19 coronavirus, while taking the utmost precautions in providing a safe environment for our employees and other patients who are currently in our hospital. We want all of you to know how strongly our team truly cares about you and how we need you to support us and work together as a team, since this is the only way we'll be able to successfully combat this virus. I would also like to encourage you to feel free and ask questions and comment below, and we will do our best to answer any concerns that you may have. Overall, we would like to thank each and every employee for their dedication to our hospital in helping us provide our community with exceptional health care. Thank you for taking the time to listen to this video, and please share it as you see fit.